What's up, guys? My name is John Hawes, RNCCRN with NRSNG.com, where our goal is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. To help you succeed on this journey, we've created weekly cheat sheets that we send to you every single Friday. To sign up, head over to NRSNG.com/freebies. That's NRSNG.com/freebies. And every single Friday, we'll send you a cheat sheet on pediatrics, OB, med-surg, mental health, ICU, critical care, every single aspect of nursing care to help you succeed. That's NRSNG.com/freebies. All right, now let's roll into the show.
What's up, guys, and welcome to the podcast. My name is Katie Cleaver, and I am your host. Today's episode is titled Work Smarter and Not Harder. So one of the biggest aspects of time management is truly working smarter and not harder. A lot of people think that the best way to achieve your goals is to just work hard. But if you work hard and don't have a strategic plan about what you're doing and why you're doing it in the order that you're doing it, that's not going to get you where you need to be, especially with nursing. There's so much to consider, and it's not just about working hard, it's working smart and hard. And the combo of those two things will enable you to be not just a really efficient nurse, but a really good nurse. And you'll be able to take care of a lot of tasks and a lot of things, and also enable your patients to feel cared for as well. So that is so important. You can't just put your head down and just do one task at a time and then only think about the next task when you've completed one. It's really important to have a strategic plan every shift. If everything goes right, which it doesn't always, sometimes you walk into your shift and you're dealing with a deteriorating patient, an upset patient, maybe some administrative issue. You might have a challenge right away, but that's not every shift. It's important to know, okay, if I'm managing my time the way I want to, roughly at 8 a.m., this is how far I want to be. At 9 a.m., this is what I want to typically be doing. I want to be done with my meds and charting by 10:30, those kinds of things. So that if you get off track, you know where you need to go back to, if that makes sense. So I'm going to give you a couple things to consider and basically a bottom line. So first of all, when you're thinking about working smarter, first consider what tasks can be consolidated. So when I go into the patient's room, can I change their dressing while I'm giving a bed bath? Can I take them to the bathroom after I give them meds? Can I check their blood sugar, complete an assessment, and then give their meds all in one trip? They have 7:30, 8 o'clock, 9 o'clock meds. Can I give them all at 8 a.m.? Consolidating trips, consolidating tasks can save a lot of time. Think about it. Every time you go into a patient's room, hi, hey, it's Katie. I'm coming in here to give your meds. How you doing? How's your pain? Okay, here's your meds. Chat with the, loved one. Take the meds. Okay, is there anything I can get for you? Nope. Okay, I'll be back later. And then, okay, now I need to take everybody's blood sugar. So then I go grab my blood sugar thing. Hi, I'm back again. I gotta check your blood sugar. Here, let me scan you and do this and check your blood sugar. And you think about, well, what if I had brought in the blood sugar machine when I was given the meds? So I could have given the meds, and then while the patient was working on them, I could be scanning their wristband and letting them know, hey, can I have your finger real quick? Here you go, okay, your blood sugar's this. So consolidating trips cuts down significant amounts of time. So let me say that again. The bottom line of this first one, the less trips into the room, the faster you will get things done. You must consolidate. Next question you should ask, what can I delegate? So let me give you some examples. Is my coworker caught up? Can he give some Zofran for my puking patient while I deal with my other patient who's screaming at the top of their lungs? Can my CNA take this patient to the bathroom and switch out the sheets and grab a blood sugar while I collect my meds and other things to start a new IV on them? Occupational therapy is rounding. Can they help the patient eat while I do their assessment instead of me feeding the patient and then them coming in and doing a whole nother thing? And then, so bottom line with this aspect of delegation is leverage the other members of the healthcare team to get everything done. Remember, guys, nursing is a team sport. You are not alone in caring for your patients. You help others and they help you. Okay, so if you can help out your coworker and give a pain med for them, they should be doing the same thing for you when you need it. So we're all kind of gelling, and while I'm technically the primary nurse for this patient, I have a responsibility to every patient on this floor, and I need to help when I can. And I also need to utilize the other members of my healthcare team, to take care of my patient as well. It doesn't make a whole lot of sense for me to go feed a patient when that is an essential aspect of the assessment of the occupational therapist. And they need to see how the patient eats. They need to see how they walk and bathe themselves. So if I know that they're coming by at around a certain time, maybe I touch base with them first and say, hey, I was getting ready to go in and do blank. Is that something you were going to do? And then allow them to do that and read their note and work with them, and don't do things twice unnecessarily. So again, bottom line, leverage other members of the healthcare team to get things done for your patient. Next thing to consider is what tasks are the most important to complete. So this is basically prioritization. But keep in mind, I'm going to talk briefly about this, but I'm not going to go over prioritization related to someone who's having, airway, breathing, or circulation issues. Those are, kind of drop everything scenarios. And I think in nursing school, you guys get pretty prepared, and even, in clinicals, okay, identifying this is a situation I need to just forget about everything else I had planned and I was going to do. I need to deal with this. And those situations do occur. However, they're not the everyday, every hour situation. You really need to know how to function normally, and then be able to identify those situations and deal with them appropriately. But what do I do when everybody's fine? So we're going to talk about those kind of prioritizations. So here's some things to consider when you're thinking about which tasks to do first. Number one, are there any time-sensitive medications that my patient must have? So, insulin is the top one I always think of. A lot of patients in the hospital are on insulin, and you need to give that within a certain amount of time related to their food. And that was the one thing that really bit me in the butt when I started doing day shift, because on night shift, I only had normally a blood sugar around 9 p.m. and a few patients would have like a 3 a.m. blood sugar, but I never had to deal with blood sugars with meals. And then when I started days, it was like, oh no, oh wow, this is a priority. And I kind of forgot about that because I had been on nights for a while. So take a look at your med list. And what I like to do, I get a report on my patients and I pull them up and I take a look and see who's got meds due first. But then also, what are the meds? Are they time sensitive? Is it an antibiotic? Those are time sensitive. You have to give those in a certain, schedule so that they are at their peak in the patient's blood system appropriately and all that. So, antibiotics, insulin, there are some heart medications and, things like that you want to make sure that you're giving appropriately. And giving a blood pressure pill 2-3 hours late can get you, as well as maybe pain medication. If we're giving pain meds and you're waiting too long to administer the oral pain medication, and now the patient's in significant pain, that oral pain med might not cut it, and now you have to give an IV dose to kind of catch back up. So keep in mind, number one, are any meds time sensitive? The second thing I want you to consider is, do I have a bad feeling about anyone? And not like I have specific, okay, these vital signs are whatever, and it is on paper that this person, I need to address them. No, I'm talking about those patients that are like, this guy doesn't look super great. I don't have something specific, but I think it would be good if I saw this patient before I saw everybody else, so I can get a good assessment just in case something happens. So keep that in mind, just so you can have a really good understanding of what's going on with them in the event that something should. Because a lot of people have kind of sixth sense, I guess, or can kind of tell you technically they look fine on paper, but there's something going on. And you really don't have anything to act on. And if you call the physician, you might not really have much to say, and they might not even be able to have something to do at this point. But, check out those patients you don't feel so great about. Check out them first. Next thing to consider, is anyone waiting on me to do something? So a couple examples. Is the patient waiting on you to give them a medication before they can go to dialysis? That was a big one that I would have first thing day shift. Or is the CNA waiting for me to disconnect the IV fluid so the patient can shower? Or is the patient waiting for me to give them insulin so they can finish their meal? Or maybe is pharmacy waiting for me to chart an accurate weight so they can dose the medication? So if someone's waiting on me, that kind of pushes things up to my prioritization ladder, I guess. And then another thing to consider is any single patient going to take substantially longer than others? So I kind of talked about this in the last time management working smarter, not harder episode, but let me dive into it a little bit. So if I have one patient that will require a lot longer to give meds, maybe I've got to crush them or cut them just so they can swallow them. Or maybe they have dressing changes or a bunch of IV meds, or maybe I need to change their linen and do a bath or something like that. But my other patients are pretty straightforward. I can talk to them. They can tell me their issues. I can give them pills, and and their assessment's not too far off. So typically what I would do is save the most labor-intensive patient for last, so I don't get caught in that room for a really long time and neglect 4 or 5 other people. So if I do that and I save them kind of for last, maybe I might get in there late, but I'm only late on one person's meds and stuff rather than 4 or 5. And typically before I kind of do that, I'll peek in on that patient that's going to take a while. And I'll say, hey, I'll be with you guys in a minute. Or not a minute, it'll be longer than that. I'll be with you guys shortly. I'm going to go peek in on my other patients, give them their meds real quick, and then I'm going to be in here for a while with you. And it's probably going to be about an hour or so. Is there anything I can get you? And then otherwise, I'll see you guys in about an hour. And that kind of lets them prepare. Okay, they're going to be here in about an hour. If I have something I need, maybe I'll wait, that kind of thing. And it typically cuts down on call-outs and it increases communication. So, bottom line of my prioritization. Complete the most important task first. Complete the most important, time-sensitive, someone else is waiting on me tasks. And also do those quick tasks first. Communicate appropriately so that you can spend more time with another patient and let everybody kind of know your plan. And that's kind of the bottom line for that one. So that's some, information on time management. So keep in mind though, just because someone's experienced doesn't mean they're awesome at time management. I know nurses that are brand new or nurses that have been there for a year that are really good at time management. And then I know those that have been nurses for 20 years and they're always clocking out late. So just because you're an experienced nurse doesn't mean you're wonderful at this. Some people are better at this than others, or some people recognize that this is something I need to get better at, so you're constantly looking for, okay, while my patient's taking their meds and I know I need to be in here while they're taking their meds, maybe I'll chart a few things. Maybe while I'm waiting for blank to happen, I'll chart some stuff. Or I know it's a little awkward when I'm sitting next to the patient on the computer and there's silence, but hey, I gotta chart what I need to, and it's really important that I do that. This becomes more and more apparent once you're fully taking care of a patient load and you are ultimately responsible. You get a report on 6 patients and suddenly you learn you need to start an IV, hang fluids, 3 calls that are on hold for you, take someone to the bathroom, call pharmacy for a missing antibiotic, and help our coworker pronounce, this patient in the next room deceased, and then send a request to the blood bank, and yada, yada, yada. It'll take time. You'll do things inefficiently, but when you feel how inefficient something is, it really kind of motivates you to do it differently and figure out a faster, better way. And keep in mind, just because I'm doing something quickly faster, doesn't mean I'm doing it with less quality or less care. I'm just looking for ways to maximize the efficiency of my time. And I like to compare this kind of to the student that maybe they study, they've got an exam, on Friday, and they just allot all of Thursday night to study, and maybe they've studied for 16 hours in a row. But is that really better? Because technically they're studying a long time. Is that really better than the student that studies 2 hours every night for very focused, intent studying and is very efficient with their time, as opposed to the person that takes substantially longer but doesn't necessarily get the same quality or the same results? So keep that in mind. Just because something is done faster doesn't mean it's done less, with less care, or worse, I guess, if that makes sense. So thanks, guys. Got more episodes about time management coming up. Go check out our academy. We have lots of wonderful information about tons of different body systems and courses, as well as NCLEX prep kind of stuff. So go to nrsng.com/academy. Take a look at that. It's $1 for a 3-day trial. It's pretty awesome. So thank you guys for listening. Have a great day.
All right. I hope that was helpful today, guys. I hope that gave you some motivation, some inspiration to go out and to be your best self, to go out and to become the nurse that you want to be, to make a difference, and to do the best work that you can. Listen, we're here to help you along your way. At NRSNG.com, our goal is to give you tools and confidence to help you in nursing school, on the NCLEX, and in life. One of those tools we created is our Friday Freebies, these weekly PDF cheat sheets that you can refer to on the clinical floor, in the classroom, and just throughout your entire career as a nurse. To get these cheat sheets, head over to nrsng.com/freebies. That's nrsng.com/freebies. You guys, if you need anything, we're here for you. You can reach out to us on social media or via email at contact@nrsng.com. We want you to succeed. We want to help you along the way. We're here to hold your hand. We're here to give you the tools, the confidence that you need to achieve success in this journey to nurse. All right, so you guys know what time it is now. It's time to go out and be your best self today. Happy nursing.